Imagine a world where a preventable childbirth injury leaves women incontinent and ostracised from society. Well, sadly, this is the grim reality for over 100,000 women living in Uganda today who suffer from obstetric fistula, a preventable childbirth injury. An obstetric fistula, it affects the world's poorest and most vulnerable women. And then the fistula itself further exacerbates this vulnerability. So let's start with the story. So, this is Grace. 14 years ago, Grace was giving birth to her first child. And she was giving birth in her rural village, as was the norm. However, Grace's baby was too large to come out naturally. And Grace didn't have the means nor funds to be able to get to a hospital. Grace was in the pushing stages of labour for 3 days. And this caused two things to happen. Firstly, Grace's baby passed away. And the second thing that happened was the pressure of the baby's head in Grace's birth canal caused the tissue between her birth canal and her bladder to die. And that caused a hole to form between them, and that's what a fistula is. This causes a constant urine incontinence. And not only was Grace then having to deal with the trauma of the loss of a child and this new incontinence, but because of her smell, her husband left her. Her family abandoned her, and she was completely ostracised from her community and unable to find work. And this is what Grace's life has been like for the last 14 years. Every day has been a struggle. And she came to one of our last surgical missions, and we were able to successfully repair Grace's fistula. And I can't describe the feeling in the post-op ward the next day, but for the first time in 14 years, Grace woke up in a dry bed. And she'd almost lost hope. And she was now filled with a new hope of what this new life may bring her. Obstetric fistula in Uganda is treated usually in fistula camps or surgical missions that are run by not-for-profit organisations. We bring surgeons with expertise in the area to a local hospital. And over a period of 4 to 10 days, we operate on all the women in that surrounding area who've got severe incontinence as a result of birth trauma. The Lung Project is one of these organisations, and during our last surgical mission, we operated on 58 women across 2 hospitals, one in rural Western Uganda and one in Northern Uganda. All are women exactly like Grace. Now, these surgeries not only serve to treat the incontinence, but they also allow these women then to reintegrate back into society, to find a partner, to find work. Gives them back a life of independence and dignity. During these surgical missions, we also train the local doctors and nurses in how to prevent, how to treat, and how to diagnose obstetric fistula. We also pay for everything. Grace and women like her can't even afford the bus fare to get to the hospital. So we cover the costs of their transport, of their food, medication, equipment, overtime costs for staff. And even with all of this and a 2-week hospital stay, it costs only 500 Australian dollars or 330 US dollars to completely change one of these women's lives. Crazy, isn't it? How with such a small amount of money, we can make such a difference. So when I last met with the Ugandan Ministry of Health, they asked me, what is the mission of the LOT project? And I turned to them and I said, not to exist. And I mean that, I really mean that, not to exist. To be able to prevent enough new cases of obstetric fistula and to be able to train the local doctors to be able to manage the caseload such that organisations such as ours, external organisations, don't need to exist. And these women should be able to be managed in local hospitals by local doctors. Prevention is key. And one of the ways of preventing obstetric fistula is to improve maternal health care and to give access to women who need a caesarean section, one in a timely manner. One of the hardest days in my career so far was when I was working in rural Uganda as a doctor. And in one day I had 2 young women who had just given birth pass away. They've been my only deaths in my obstetric and gynecology career. Well, both in the one day. And I promised myself that these deaths would not be in vain. And so what I did was I did an audit together with the obstetric and gynecology department of the hospital I was working with of all the women who died in the last year. And not only what were the medical reasons of why these women died, but what were the intrinsic hospital factors and what were the extrinsic community factors that were contributing to these deaths. And one of the things that kept coming up was this issue of access. That women would have to travel 5-6 hours in critically ill conditions to be able to get to a hospital. And often by the time they would arrive, it was too late to save them. And so one of the projects that we came up with is what you're looking at here. It's a high-risk maternal waiting home that has now been built in the hospital that I was working at. It's where we identify women who are at high risk of having birth complications, women with previous caesarean sections, twins, bleeding issues, previous fistula, and we invite them to stay in this home on hospital grounds close to their delivery date. And from there, elective management can be made. And also, if there is an emergency, they're not travelling 5-6 hours to get to a hospital. They're getting medical care when they need it. So this is how obstetric fistula is treated today. We've got the injury, we've got the surgery, and then once these women's incontinence is fixed, they're able to reintegrate back into society. But what if we can do better than this? What if part of that reintegration we could also help prevent obstetric fistula? What if we could do a model that looked a little bit more like this, where we have different parts that are positively working together to tackle the root causes of the issue? So we've got capacity building, so that's to training the local doctors and local nurses on how to prevent, on how to treat, and how to diagnose obstetric fistula. We've got the much needed surgeries, because no women should have to suffer like these women suffer. And then we've got the reintegration, and we're doing a pilot where we're offering to teach these women skills that could hopefully prevent future fistula cases. So in order to recover from these surgeries, it only takes 2 to 3 days. But these women are in hospital for 2 weeks, and they're in hospital because they've got a catheter, and it takes 2 weeks for us to remove that catheter and safely send them home. So we're using this as an opportunity and offering to teach these women to become healthcare workers for other pregnant women. And this project is threefold. 1, we give these women a new set of skills and knowledge and income to be able to return back to their communities. 2, we're empowering them to better their healthcare in their community and obstetric care. And 3, we're allowing them to prevent other women from suffering like they have. And through prevention projects like this and the maternal waiting home, perhaps we can decrease the number of new cases of obstetric fistula in order to be able to create a caseload that's more manageable to be managed by the doctors, the local doctors that we're training. And this is the cycle that we're promoting. Training local doctors to do these much needed surgeries, to then allow these women to reintegrate back into society, and empowering them to help prevent future cases of obstetric fistula. And with this, the maternal waiting homes, hopefully reducing the number of new cases of obstetric fistula to allow for a more manageable caseload to be handled by the local doctors that we're training. During our last mission, I sat with these women and I listened to them, dreaming of a new future after their surgery. And I invite you all today to also dream of a better future by supporting projects like the Maldon Project. We can together create a sustainable solution to obstetric fistula through capacity building, through prevention, through reintegration projects, and through empowerment, and all these things synergistically working together. We can pave the way to a better future, one where every woman has access to quality obstetric care, and women living with obstetric fistula are able to rebuild their lives with dignity. Every woman has the right to a safe birth and a life of dignity. And let us together make this dream a reality. Thank you.